My name is Cindy Newhouse. I am a grad student at Thomas More University, and this report is on Mpox, which was formerly called monkeypox. Bit of background information. I have been employed in healthcare for about 33 years, and I got to see the coronavirus from its very beginnings in China and the way that it spread across the world into the United States and how it became a pandemic. And I was interested in the Mpox virus or monkeypox to see how it could spread from an area in Nigeria, Africa to Kentucky. Pox has two forms known as clades. Clade 1 is the deadly virus that is almost isolated in Africa. Clade 2 is the one that is being seen worldwide and in the United States. The case definition of Mpox is pretty much the same universally. It is primarily a sexual transmitted disease that is most prevalent in the homosexual male population. Although there are some children who get it, and it is also a zoonotic transmission, so it can be obtained from infected animals, and that can include hunting or eating or even cuddling with a domesticated animal or pet. As of early September, there were 4 cases that were confirmed in Kentucky in the year 2024 and 24 cases in Nigeria in the same year. There have been a total of 111 total confirmed cases since they began reporting at the beginning of the outbreak, which was around 2017. And around the same time frame, Nigeria started documenting cases. They have had 985 reported cases where the patient was symptomatic, and they have had nearly 400 confirmed cases. There have been no fatalities as of yet in Kentucky, but in Nigeria there have been 12, giving a case fatality rate of 3.0. And that was from the clade 2, which is the less fatal. The most prevalent mode of transmission and the social determinant of health is sexual, again, in the homosexual male population. For homosexual males and bisexual, it is interesting to note that it is a criminal offense to be homosexual in Nigeria. So a lot of the population doesn't receive information. They don't practice safe sex, and they are not getting vaccinated or reporting any symptoms for fear of persecution. There are also occupational risks for healthcare workers who are exposed to needles or any contaminated clothing or any equipment that a contaminated person could have. The spread of zoonotic, again, it can be mostly wild animals, but can also go to domesticated animals and pets. And the socioeconomic factors are, again, the criminal offense, but also it's mostly lower to middle class. The heterosexual male population, but also sex workers or those who participate in high-risk sexual behavior. Main presenting symptoms of Mpox are similar to flu or COVID or a lot of other diseases, and they are primarily fever, chills, swollen lymph nodes, fatigue, myalgia, back pain, headache, sore throat, nasal congestion, cough, and a rash that is very distinctive and has small pustules. And by the third day, the pustules will open and will start to drain. And that obviously ramps up the risk of contamination. In Kentucky, presumptive cases are screened by symptoms, and they do a lab test, which tests the molecular testing, and then a confirmed case that's confirmed with molecular testing also, but also in DNA with genomic sequencing. In Nigeria, they do an ELISA test, and that can show past exposure, and they can also do viral isolation to 100% confirm that it is Mpox. With Mpox, the biggest danger is that there is a rapid spread. With international travelers, it's nearly impossible to screen they can screen the passengers that are coming directly from Nigeria, but if they've been to other countries first, then it's hard to catch them. But also, you can catch it, it's spreadable through skin to skin, respiratory droplets, and contaminated materials. But there's no evidence of transmission on something that the person has only touched briefly, such as parts of the airplane or the controls on an airplane or something where a flight attendant or an adjacent passenger would be in danger. As far as public health, it creates a strain on the public health personnel because they want limited contact, so only certain healthcare workers are in contact with patients with Mpox. And vaccine and treatment challenges are, again, a lot of people who are showing symptoms or have concerns are afraid in Nigeria to come forward. And also the vaccine right now is very limited and only given to those who have high risk factors. In Kentucky, one of the biggest strengths is the infrastructure because in the larger hospital systems, there are a wide range of services that are not available in other places. And in the larger areas, such as Lexington and Louisville, a lot of times there's an affiliation with outside services such as the Mayo Clinic and Cleveland Clinic where they can get advice. There are a lot of rural areas in Kentucky and a lot of low to middle class working communities where health access might not be available at times outside of their working times and they cannot take days off. So up through telehealth and patient portals, that has been a huge strength. And again, with the health outcomes, a lot of people don't want to take off a day of work, or they don't have insurance, or they don't have childcare, and those are factors that keep them from coming to get treated. For Nigeria, a lot of it is self-pay, and the government doesn't want to invest a lot of money, so it is just run on the fees from the users. A lot of their medicine is traditionally based, and they use faith healers and spiritual leaders as well as doctors. There are high rates of mortality, especially in infants and maternal mortality. But a lot of it is because they don't have access to clean water. There's food insecurity. There's a lot of air pollution. There's inadequate sanitation and a lot of things that contribute to chronic illnesses.